Thank you. Okay, yeah, so I'm Ellie Dommet. I'm from King's College, but I'm talking today on behalf of the SMaRteN network. And as I'm going to say shortly, I'm not the main person that looks after SMaRteN, but they're on maternity leave, so I'm kind of here as a mat leave cover. So I'm just going to spend a little while talking about what SMaRteN is and who's involved. And I was going to spend a fair amount of time talking about the priority setting exercise that SMaRteN undertook quite early on in when the network was created. And that really was an exercise conducted very much with students to find out what students felt was critical in terms of research going forward into student mental health. Then I'm going to talk about some of the research that we did during COVID for mental health, and then some of the next steps for SMaRteN. So SMaRteN is a UK RI-funded research network. It's sort of based at the Institute of Psychiatry at King's, but has a whole big range of people from across the UK involved with it. And so within the sector, there's been this kind of drive, and I think some of the themes that have come out of the previous talk are going to come out of this one as well. We know that all of the student support services at nearly every university, I've never seen a university stand up and say, actually, ours are fine, they're not oversubscribed, they're not struggling to meet demand. So within that comes this drive for, we need more student support services, which may well be the case, but one of the things that SMaRteN had as its remit at the start was to try and understand the factors around student mental health that extend beyond just student support services. So looking at institutional and social factors that impact on student mental health. And one of the last points made in the previous talk about this idea of embedding well-being in the curriculum, looking beyond the traditional places to put student support within universities. So the network began in October 2018. It should have finished, but because of COVID, we got an extension, so we're still running. So we're now running until March next year. But as you can see from those dates, we're sort of well into the network's funded existence, but we hope that some continuation will happen just out of the network of researchers that's evolved. So what were the key things that SMaRteN set out to do? Well, we wanted to understand what's distinctive about mental health and wellbeing in university students as opposed to young people in general, or young people going through significant life transitions, because of course university, transitioning into university is a huge change, and it happens in adolescence, which is another huge change. So there are likely to be some unique factors around student mental health that wouldn't be found in non-student populations of a similar age and socioeconomic group. So we wanted to unpick more about the factors that influence student mental health, looking across what an individual may experience and what may be experienced as a direct consequence, for example, of studying a particular qualification, studying in a particular area. So the overarching aim, I guess, is to look at how we could enhance the well-being of students across an institution. So I think that's quite an important point to make, is that this isn't just about the students that actively seek out help, and this isn't about students that come in to university with existing mental health concerns, or those that develop it at university. It's literally about everybody. So the students who wouldn't necessarily identify as experiencing any difficulties, it's about ensuring that their well-being is enhanced or at least maintained, as well as those that might experience challenges along the way. And obviously, of course, this network started pre-COVID, so we weren't really targeting COVID-specific issues, although that did come out because of the flexibility of the network structure. So SMaRteN works with researchers from a huge range of backgrounds, and I think you're hearing from at least one of them later today as well, which brings in lots of different expertise. So that's expertise in terms of whether people are perhaps part of frontline mental health services for students, whether they are more in a typical academic personal tutor role, but also cross disciplines in terms of their research backgrounds and skills. And one of the things that was a priority, was to engage students in this network. So this wasn't a network where academics sit around and decide what we should do in terms of student mental health, because that happens with, quite a lot of research areas are decided by the researchers with almost no engagement of those that we are researching, although that is changing with participatory research and funding to support that as well. So what SMaRteN does as a network, what it has been doing, is funding research for individuals. So in effect, the UKRI gave SMaRteN the money and we just pass it on for the most part to other people. So to date, we've funded 19 different projects at 14 institutions. So there's been a call that goes out, people put in a bid to that. So it's obviously, it's not like putting in a massive UKRI grant. It's a relatively streamlined procedure, which is nice. So people put in a bid, and that will typically be, quite a few of them have been institution specific, as in their institution may have a specific unique selling point of its cohort, and that could relate to the demographic features of the cohort. Some people have put in, for example, to focus on postgraduate students for a very specific reason, or female students or students from particular cultural backgrounds, and then to conduct some research with that group of students, and then obviously feed the research back into the network. So as I said, I am not really the person that should be talking about this. The person that should be talking about it is Nicola Byram, who's at the top of the screen there. But she has now a 2-year-old and a 8-month-old. So understandably getting here was not going to happen, and she is on maternity leave at the moment. So Nicola set up the network and leads the network, and despite being on maternity leave, still seems to work more or less full-time, as far as I can tell. And we have our network coordinator, who I'm going to ask to wave. Jo is at the back. Jo's at the back, so please catch her later if you have any queries or anything. So Jo coordinates the work of SMaRteN, which is anything that involves coordinating academics is obviously like herding cats. So she does an excellent job of coordinating the finances, which of course are also in academia a nightmare, and the people, and working with a lot of different projects and working on some of our really exciting dissemination work. So if anybody's interested in any of those sides of it, do grab Jo later. Student teams, of course, are absolutely essential to SMaRteN. So if it was just run by Nicola and other academics and Jo, it wouldn't work. But we have a series of student teams that come in for certain periods of time, so they didn't have to commit to the whole 3-year network, and work with researchers to come up with things that need looking at. We also have various weekly, bi-monthly discussion groups that are all held online, which is not COVID specific. It's because they are UK wide, so that allows people to join from wherever. We have an early career researchers network within that as well. And SMaRteN has done quite a lot to, I'm going to be bold and say challenge the UKRI funding approach, which is give money to money, because it has done quite a lot to support early career researchers in giving them funding, but also giving them a platform to discuss their research and allow them to be part of a network, which of course is hugely critical in building their career. So, couple of sector-wide collaborations probably worth mentioning. So there is the What Works for Wellbeing, which is an Office for Students funded consortium, and that is actually, that's quite new. So despite SMaRteN sort of coming to its formal funded end, there is new things starting. So that's with TASOS, and it's around, so it includes several stakeholders. You'll notice there that this isn't just universities, so we have got Student Minds, Universities UK, and it's looking at creating this online hub of resources of what works well for student mental health and well-being. And then there's also the Connaught Global Challenge, which is, as the name would suggest, an international project, again looking at creating a network to support student and youth mental health. So SMaRteN's a network in itself, but then it's part of bigger networks going forward. So to say a little bit more about student engagement, so we have a student research team, and they join yearly, and they are sort of recruited, and they will work with us through monthly meetings to feed into research projects. So students review, or we've now finished our funding calls, but students were critical in reviewing the grant bids that came into us as well, and able to give scores and rankings for the grant bids just as other people on the panel would have done. They're also fundamental to the podcast series, which Jo has worked really hard on and can tell you more about her experiences of that if anyone is interested. So these are student-hosted episodes where they focus on SMaRteN-funded research. So not only are students involved in deciding what research is funded, but then they're part of the process of disseminating that when it's done, which is really nice. And we have another series of that coming out. So we had the first series, and then we shortly have another one, which we're sort of just at the commissioning phase for. There's also a co-creation project, and that's the one where we have a specific call for early career researchers and students to collaborate. And students can then be co-authors on the product of whatever that research is, if it's a report or obviously a conventional research paper. So student engagement is quite central. It's also paid, so we're not expecting students to give up their time for free. And I think that's really important, because the moment you make these opportunities, if that's even a fair word to use, voluntary, then obviously you impact who is able to take up those opportunities in a way that I think can discriminate against certain groups. So student engagement is core, but it's making sure that it's equitable and fair engagement. So just to mention some of the virtual groups, we can share any of that information afterwards. So we've got the Education for Mental Health Special Interest Group that happens on Wednesdays. I think we are actually on a break for the summer for some of these because people aren't all consistently around. Then there's also a virtual lab group meeting for early career researchers, and then there's a PhD one as well, and then we've got a special interest group on measuring mental health and well-being in student populations as well. So there's various different groups, and if you're interested in joining any of those, or even just dropping into one or two and thinking, is it something I'd like to be part of, you can just email smarten@kcl.ac.uk. And that will be picked up by Jo, who can send you more information. Okay, so I said I was going to talk a little bit about the priority setting exercise, and this has been fundamental to everything that's followed after this has happened. So it was really critical to kick-starting SMaRteN. So we know, of course, and you've already heard this morning, we have this increasing prevalence, pre-COVID, increasing prevalence in mental health problems in young people, and particularly university students. We see the odd, very high-profile case in the media, and we know that support services cannot meet the demand at the moment, and they're typically found with very long waiting lists, this need to identify and put yourself forward for help. I know, so the website was mentioned for City. I mean, I can literally never find anything on King's website. The only way I can find it is to Google it. I can't even search through King's. And that's when I'm looking for something with no apparent distress, or at least not when I start looking for it. I get increasingly irritated as the time goes on. But, you know, many of our services can be inaccessible through very minor means and things that perhaps have relatively quick fixes. The current approach of providing student support through counselling and support services is not going to work long term. We need to be looking at a kind of systems-wide approach. But most of those don't actually have a firm evidence base. So one of the things that SMaRteN wanted to do was to contribute to that evidence base, but in a way that was led by the students. So they set out to consult students right at the start on the priorities of the research, to ensure that the needs of the students are met rather than the needs of the researchers, which of course are not necessarily going to be the same, and in fact probably quite unlikely to be the same. So the priority setting exercise was set up so that students, both with and without lived experiences of mental health difficulties, were recruited as peer researchers. So they are co-researchers in this project. They are not test subjects. They are not one of the people we consult. They were at the core of the process. Those students worked with other key individuals, so clinical psychologists, tutors. That would be like the personal tutor role, which of course is often at the front line of student support, and academic researchers around mental health and wellbeing. So in the end, so that was the research team, and then they worked with around 400 UK university students across the UK, so not just at King's, not just in London, recruited through various different means. Now, obviously, it's like any of these things, people recruit, people apply to do things that they are interested in, so you will have some kind of element of self-selection bias in there. That can't be helped, but actually, if the people that are interested are the people that would be using these services, they're the right people for us to hear from anyway. And they had a really, really quick and easy question to answer, in a sense. Well, quick, maybe not so easy. In terms of student mental health, what do you think the priority issues are for researchers to explore? And they were just asked to submit 3 things, that they're up to 3. So if they didn't have 3, that was fine. And in the end, there were just under 1,000 questions submitted. They were then coded, and any that were very unclear, and I'm sure anyone that's done online surveys, you get some where you think, I've literally no idea what's being said here. So if that was the case, they were removed. And then they were categorized, and so we ended up with 7 categories, and the 7 categories are shown on the screen. And it's quite reassuring to see that they did align with the things that were mentioned in the previous talk. So intervention and services, that's going to be obvious. Mental health literacy, so looking at levels of mental health literacy in students and how this could be effectively enhanced. Sense of belonging, and I'm going to come back to that in a little while. Academic factors and work-life balance. So one of the things that I'm particularly keen to do outside of SMaRteN is look at how we can look at how actual active academic work impacts on wellbeing. And I have a soon-to-be, I suspect, soon-to-be failed grant, which will then go off somewhere else, looking at things like different types of pedagogy and impact on wellbeing, digital skills, research experience, all kinds of things that are put out there as part of the academic experience. Workload, student workload, we're not very good at modelling it. We're not very good at modelling workload full stop in universities, so it's not surprising, but looking at some of those factors, and that aligned with what students wanted as well. They wanted to understand how the academic work that they are doing could impact. And then causes and risk factors of mental health difficulties in students in particular, and epidemiology and consequences. And I put the full reference to that piece here. And I think Emma is here or will be here later, so she's one of the authors on this. And then along came COVID. So a lot of our plans changed slightly. Obviously, we'd given out research funding. Some people, most people, were able to still do something with the funding that we'd awarded to meet some of their original research aims. Not everybody, obviously, and so we had to be a little bit flexible there. All of our things had to move online, as did everything else. So we changed tack slightly. So obviously, where research could move online, if it was survey-based or even interviews or focus groups, all of that could still happen. But there was more use of existing data set and archival data to allow us to continue to operate. I think obviously early on in COVID, we didn't know exactly where the big research councils were going to stand on offering extensions. So it was a case of, let's make sure that we can carry on with something. And any interventions that could have been shifted online or support services obviously were. And we have, it's actually, I say October, but it's now moved to November. So I'm going to get the date wrong. I want to say November the 4th. But Joe can correct me if I've got that wrong for the showcase. Is it the 4th? It is. Excellent. I knew it was around then. It's a Friday. It will be at the Science Gallery right outside London Bridge Station, so nice and accessible. And we'll be talking about a lot of the research that was done, as much of it as we can get people in to talk about through the whole of SMaRteN, and I think I've got a slide on that later. So one of the things that obviously COVID had, and it's been brought up in the questions and in the previous session, is it caused this rapid shift to online learning. And I come from an online learning background, so I was not in the slide, I mean, other than the workload, I was not worried about this at all. But that brought very much to light the need to look at academic work. COVID, as terrible as it's been, is a bit like, for those of you with a psychology background, it's been like the Phineas Gage for education research, because it has forced, you know, it's been like a unique opportunity to find something really exciting out about education. And it came up earlier, the mention of digital poverty. And digital poverty, of course, can relate to hardware. More often or not these days, it actually relates to software, because hardware is cheap, but software can be expensive. But one of the areas that is really obvious is skills. You know, we saw our academic staff suddenly being asked to produce videos and all this kind of stuff while stuck in their house with no access to anything. But we also saw students in the same situation being asked to do novel types of assessment potentially, or have all their study online when they may not have had an ideal situation, as in a physical space, ideal devices, or even the skills to do it. So one of the things that Nicola and I led during the immediate pandemic, because not one to think we've got to get teaching and learning online, we must focus on that. We thought, I know, let's put in a grant to look at this instead, was we looked at loneliness and well-being during the first lockdown. We did actually do a follow-up after things had started to return, but I'm not going to talk too much about that. So what we found, it was a big online survey. It was focused on King's, which means it's a single university. It's also a single university where we have, a bit like City, we have quite a lot of commuter students, but we also have a very big group of international students who, of course, due to travel restrictions, became stuck very, very quickly for a sort of, at the time, very unknown period of time. And we looked at what factors predicted loneliness in the students during the first lockdown. Age was a factor. So that was with younger students feeling more lonely. And that wasn't, by the way, because older students happened to be living with family members or things like that, because we'd taken living arrangements into account. Discipline also affected it, so discipline of study. Now, I should say here that once you start chunking up a sample of 400 into discipline, sample sizes become smaller, so we have to take that with a bit of a pinch of salt. We divided it across 4 discipline areas. And it was arts and hums students that were more likely to be lonely. We don't have an explanation for this, but one of the possibilities is simply the differences in teaching models that are used. You know, if you're going into an engineering lab doing a practical and leaving, that could be quite a different experience to a seminar or a tutorial in an arts discipline where you are more directly engaged with your peers. So that's possible. It could also just be that arts and home students were lonelier to begin with, and of course we don't have that data. Connection to university was quite a big thing. So the students that felt more or less connected to so how connected they were to the university impacted their loneliness. And interestingly, it seemed that those that are more connected were more lonely because that connection had been severed overnight. And I think this is interesting for when we think about students graduating from university, taking a year abroad, going off on placement. We want students to feel connected to their university. That all sounds on paper like a really good thing. But actually, when that connection changes, so students who interrupt their studies, and of course some students interrupt their studies not through any of their own concerns, but perhaps a family member needs caring for. So they in themselves are fine, but then that connection is cut off. And what are we doing to support students after that transition? So that was quite interesting. More work's clearly needed on how we can develop a healthy connection to the university that can survive a student graduating, or more importantly, that the student can survive their graduation without suddenly feeling a bit disconnect from everything they had before. And the one that I was personally most interested in because of my background in online learning was digital confidence. So we measured both digital confidence and digital skills. we used the GISC measure, so GISC let us have their massive measure for this. And what we found was that skills and confidence were ultimately related, so nobody was delusional about how skilled they were. They weren't sort of saying, I can't do anything, but I'm really confident. Everything matched up as you would expect. But actually, if they didn't have digital confidence, which was predicted by the level of digital skill, they felt really lonely. And this makes perfect sense. I'm of a generation where my parents don't have smartphones. I'm trying very hard to encourage them, but my dad barely uses the old mobile phone he's got. So when the lockdown happened, I can't be the only person of my age that had a 3-hour conversation trying to help my mum and dad learn how to Skype. It was painful. But we got there, and actually that was the only way my mum and dad were able to speak to me or my brother and his family for the best part of 6 months. And I think people didn't forget older people in terms of digital literacy, because everybody, the myth is that they can't do it. You know, older people can't, they're not very good with tech. Equally mythical is the idea that digital natives exist. They don't. And what we know is that the students who lacked digital skills felt a lot more lonely. And that's not surprising, because they weren't necessarily able to go onto the discussion boards, use the Teams chat as easily, talk to each other via WhatsApp, Skype, etc. So they just felt much more lonely when they didn't have those skills. And that's a very practical thing that we can work with in terms of reducing loneliness. We also looked at well-being. So we had the kind of both the positive and the negative, and we found that well-being was predicted by the factors shown on the screen. So again, connection to university, suitability of a study space at home. So we didn't ask for details, we just asked if they had somewhere they could study sensibly at home. We know from another piece of work we did that often it is shared devices with younger siblings, lack of quiet space that can be problematic. Digital confidence came in. More lonely people had lower well-being, not surprising there. Student identity. Now this is a really tricky one. You want somebody to have an identity as a student of X university. You know, that's what universities create their brand by doing that. And it creates a sense of belonging for the student. But it also appears to impact on well-being, which, so that, you know, the stronger somebody identifies as a university student of X, the better their well-being. Predictably, an existing mental health condition impacted on well-being as well. Now, we don't know exactly why, because this is a survey. There could be all manner of reasons. It could simply be because the mental health condition lowered well-being, or it could be because we were during COVID, services were disrupted, so the support they'd previously had for it disappeared. So that was some of the work we did in the immediate lockdown. I'm going to briefly touch on some other work I've done since. So it was mentioned in the previous talk that these effects of COVID are likely to be quite long-lasting. And we decided to sort of take advantage of COVID a little bit again. The transition into university is going to be key, as I mentioned. And we know that the friends that somebody makes in the first year are typically the friends they keep all the way through. And that period of forming friendship is really important. And it's really quite difficult. I'm sure everybody here can remember, if you went to university, what that experience was like. I remember being dropped in a tower block in Sheffield, and my brother, who was older than me, had decided that the best thing I needed to make friends was a massive tin of biscuits and a bottle of vodka. So that's what he bought me, and he went, off you go. And then my parents, as I left, literally shoved me through the door of the person that moved into the room next door to me with my biscuits. They decided it was not time for vodka, because I think it was only about 11 o'clock, and said, right, go and make friends. And I was like standing there with a tin of biscuits. But actually it's really difficult, and I think we underestimate how difficult it is. And I'm standing there and saying that as a white middle-class girl going to study psychology. I mean, I could have literally tripped over people that were exactly the same as me. So it can be really challenging. So what we did was we compared students who started their degree in 2020 when everything was online, as in September, October 2020, with those that started before and those that started afterwards. because the ones before had had that typical period of making friends before COVID hit. 2020, everything was online, very little opportunity to make friends. Quite a few didn't even come to live in their university city because of everything online. 2021, back on campus, but with certain restrictions like face masks and some distancing. So we had this kind of neatly designed study, and we looked around 230 students. So we did measure various things. I'm just showing belonging here. So what we found was we didn't find any differences in loneliness, but we did find differences in belonging. And it looks as though students who started, so the black bar is our kind of starting in a typical world in 2019. The grey and the white are the later ones, and those students have less of a sense of acceptance, so that them being accepted by others at university. And the 2020 group in particular felt a greater sense, so this is like an awkwardly reverse scored, but a greater sense of rejection. The fact that there is still a lower sense of acceptance when people are back on campus suggests that these impacts are going to be quite long term. Now, obviously, those people in the 2021 cohort had their A-levels or equivalent very disrupted. So they had quite a lot of disruption through that late adolescence period that could have impacted this. But what this tells us is that although there weren't obvious changes in loneliness, there were changes in sense of belonging. And given that sense of belonging is likely to relate to all kinds of other things like our identity as a student, if you don't feel like you belong with your peers at university, you're less likely to have that identity as a student, which we know impacts well-being. So that was some of the things that we looked at. We then did, so we also looked at what does predict loneliness in this particular study. And rejection and need to belong. So if somebody is has a very strong desire to belong, to fit in, they're often more likely to experience loneliness. That's not surprising, given that loneliness is in part a mismatch between expectation and reality, or desire and reality. Support from a significant other was important, but not necessarily support from friends, which is a little bit surprising because in adolescence it does typically seem to be friendship groups that are more important. Family didn't show up either as a predictor. So what we might be seeing is just that these individuals have ended up in a situation where their support networks are different to previous cohorts. So they still have support, but it might not be from the groups that a previous cohort had. So one of the areas that we think needs to be worked on, which also ties into the priority setting, is looking at how we can support students in creating a sense of belonging. And there's some researchers listed on the screen here, so this isn't my work, that says looking at academic, social, surrounding and personal space. And so universities shouldn't just be trying to foster belonging to a particular thing, they need to be fostering it in 4 areas. So I think, I'm trying to remember if that one is still on the list, but you hopefully will be hearing from some more SMaRteN people later on. And there is also lots of information on the website, which I put the link up to there. We're also on Twitter. I think we may be on Instagram, but I don't think we do very much on there. So Twitter is the place to follow us to hear about different things. And Nicola will be back in around August, so I will still be involved, but Nicola will be back and no doubt doing lots of exciting things. But we really hope that if any of this has been of interest, that you come to our showcase. We are hoping to have some travel grants. We haven't firmed up all the details, but we're hoping to have travel grants to support anybody that might not otherwise be able to come. So look out for information on that. It will all be on the website, and it is a nice shiny building, so it should be a nice place to spend some time anyway. Thank you very much.